Hello, you beautiful people, and welcome to the Monday Show. If you aren't aware, this is the show where we discuss the latest of scientific and health-related news. So let's just jump into it. Today's topic is a potential game changer. You probably came across other articles discussing this topic, but today we're going to talk about a CNN article that's titled, "With Daily Low-Dose Aspirin Use, Risks May Outweigh Benefits for Older Adults." The article covers a study called Aspirin in Reducing Elderly Events, or ASPREE. As you can tell from the title, the article is discussing aspirin in elderly and how that might affect their health. Before we talk about the article specifically, let's take a step back and discuss aspirin itself. In 1897, German scientists Felix Hoffmann and Arthur Eichengren, sorry about that, successfully synthesized the first sample of aspirin by reacting to fancy chemicals. But today, what we use aspirin for is to relieve pain, headaches, and low-grade fevers, and it's one of the most commonly used drugs in the world. So aspirin is actually chemically derived from salicylic acid, which is commonly found in plants like willow bark, and it has been used before the discovery of aspirin for the same uses, but aspirin actually has better effects. So the aspirin we use today is actually an anti-inflammatory drug as well, and it's also an antiplatelet drug. It's part of the NSAIDs family, cool name. So as you know, anti-inflammatory reduces inflammation, but what does antiplatelet mean, you may ask? So what that does is it actually prevents blood clots and it prevents vasoconstriction, which is when your blood vessels constrict and you get higher blood pressure. Because of aspirin's uses and because it's also blood thinner, it's commonly used in the elderly to lower their risk of heart attacks and strokes. Some people even are given a low dose of aspirin daily to help with their blood flow. In other studies, aspirin has actually been shown to have anti-cancer properties, which was surprising. They found that it prevents cancer and it also decreases the death rates from cancer. So in terms of the side effects of aspirin, it's been associated with some effects to our digestive system. These effects range from minimal to severe depending on the person, based off of their dose, the disease they have, how long they've been taking aspirin, and other effects. So this is something that we should keep in mind when thinking about taking aspirin. So back to our actual study. So what did the ASPREE study do? Well, the study actually worked with 20,000 individuals with a median age of about 74 for 4 years. And what they had is two groups. The first group took low dose of aspirin and the second group took placebo. So the scientists of this study conducted 3 levels. The first level found no difference between the two groups in terms of general survival. The second, however, found that there was a higher risk of hemorrhaging in the aspirin group than the placebo, specifically in the stomach, intestines, and brain. Third level found that aspirin causes a higher rate of death due to cancer. This is huge because this could mean that aspirin causes more harm than good, and all those people that are taking aspirin right now could be in danger. But the real question is, can we trust this study? Those results sound pretty promising, but let's talk about the reliability of the study itself. So the study actually sounds pretty impressive. It's been peer-reviewed, it's published in a pretty great journal that has a great reputation, and it's also what we call the gold standard of scientific research, or a double-blind randomized control trial with a placebo. So that just means that they're trying their best to minimize any bias in their study. So all this sounds really great, but like every study, there are some limitations that we should keep in mind. So first, their pre-screening of the individuals could have been more extensive, and also we can't ignore the fact that all previous studies pretty much show the opposite results and don't show that the harms outweigh the benefits of aspirin. So what can we take away from this study? First, this gives us very promising results that need to be looked into further. Second, healthcare professionals and other researchers should confirm the study results before we take the results any further. Third, don't do anything too drastic. Make sure you consult your healthcare professional before you think about changing any of your medications or your loved one's medications. If you are concerned, you can discuss the results of this study with your healthcare professional and they will know what's best to do. Finally, just stay safe and be educated about your medications and about your health. These results can be amazing in the future, but we have to stay on top of this and make sure that the study is giving us the most accurate and well-researched results.